Hey, hi there. Hi. We are in person testing this out. Hopefully the audio is good. We got new microphones. Thank you for Raz, my boy Javed, WXYZ Detroit. Go check him out if you're in the area. For Raz Javed about the new microphones. Hopefully, hello, testing. I don't know. Anyway, we're joined here with Dr. Jacinta Yeung, functional medicine. Thank you for being here. Functional optometry, not functional medicine. Sorry, that is the term in my brain. Functional optometry. So let's jump right into it. Hey, what are you doing here? Who are you? What's going on?
So I'm Jacinta Yeung Olson, and I've been practicing in Boulder for about 10 years, and then we're just going to start out now in Lafayette, focusing on functional optometry.
So tell us, what does that mean? Let's start with optometry. What is optometry?
Right. So optometry is the eye doctors that you go to mostly to get your glasses and contact lenses, but we also do check your ocular health and just help with prescription and making sure that your eyes are functioning well and your vision is functioning optimally. So specifically with functional optometry, sometimes it's called behavioral optometry. They're kind of interchangeable. But to just define vision versus sight, a lot of times when we go see an eye doctor for glasses or contacts, we kind of think more along the lines of how well you're seeing. Are you seeing 20/20? Do you need glasses correction to help you see better? And when we think about vision,
keep talking. I'm gonna see if I don't know if I actually turned them on. I think it's doing a thing now. Go ahead.
Sure. So when we talk about vision, we're talking about how we take in visual information and process that information. And so when we talk about vision, we want to think about how does what we see direct how we respond to our environment. And so when we look at vision, there's actually 17 to 20 components, depending on who you're talking to, that we really need to assess to help improve how well you're functioning through your vision.
17 to 20 components.
Right. So
break that down.
Absolutely.
You don't have to do all of them, but
yeah,
just
no,
some
again,
sense of that.
So sight, when we're looking at 20/20, when you go into an exam room, we're seeing how well you see in the distance, sitting still. However, some people, as they'll notice, or especially with elite athletes, when you're moving, that's a different skill as well. In addition, your focusing system changes. So how we see in the distance is changed when we have to focus up close. We have to exert muscles to focus accurately up close. And to sustain that for people that work on the computer, 8+ hours a day, you're using your vision completely differently. And then on top of that, we have to make sure that your eyes are teaming properly so that both eyes are aiming at the same spot and taking in the same information. If it's not, you may have double vision or blurry vision. It may affect where you perceive things to be. So for example, if someone's eyes are aligned slightly more inward, then they may perceive objects to be closer than where it actually is. So for example, a baseball player, they may consistently perceive the ball to be closer than where it actually is and consistently hit sooner than where the ball actually is.
And those little microscopic differences, obviously, when we're talking about a baseball player, could mean the difference between millions of dollars.
Exactly. Yes.
Or just embarrassment.
Right.
In that situation. I know something I've used, I think I picked up from Jill Miller. I don't know if you've heard of her, but she's kind of in that primal health space. She does yoga tune-up is her big thing. But like I'm looking out the window right now. Mm-hmm. And one thing is she talks about is just changing that perspective and trying to focus on, like, there's a blue house off probably, I'm gonna call that 300 yards away. And so just trying to focus on that, and even through the screen that I'm looking at, just changing that dynamic to make sure the muscles in the eyes are working a little bit differently. So would you say that the eyes are the muscle? And again, I don't necessarily think of it that way outside of that focusing, but they need that kind of constant variety, just like our actual bodies and functional fitness. We talk about CrossFit, and Dr. Jacinta was at my vital sign movement workshop I had yesterday.
Yes.
Would love for you to share a little bit maybe from that as well, if you don't mind. But yeah, let's put a pin in that. And in terms of the muscles of the eye, do you think that again it's vital? Again, if somebody's staring at a screen for 8-10 hours a day, from the same distance all the time as well, same color, same everything, that seems to be negative for the eyes, and then how do we start incorporating? Is there any kind of system? Is that something you guys offer of trying to train the eye and the muscles of the eyes?
Great, absolutely. So, just talking about looking at a computer all day, you know, we were hunters and gatherers a long time ago, not looking at something, you know, 2 feet away for 8+ hours a day. So even with our glasses, the strength, if you are nearsighted, the strength of your glasses that you need for far away is much stronger than what you need up close. So if you're using the same distance glasses for computer work all day, that can actually be adding eye strain to your eyes. And so something that I focus on is making sure that we have the proper eyewear for you, so that you can function optimally in what your needs are. A lot of times I talk about glasses prescriptions like shoes. And so while you can have just everyday shoes that function well, you wouldn't go on an avid hike on, you know, very expert terrain just wearing your regular walking shoes. You'd have the proper support for that. So same thing working on a computer 8+ hours a day, you probably want better glasses that are set for that specific distance.
And then in terms of the workouts as well, are there specific things like making sure you focus on something very far away, making sure you focus on something very close? Are there any kind of tips or tricks that you can provide for that one?
Absolutely. So a lot of people have heard of the 20-20-20 rule, where every 20 minutes you should look 20 feet away for about 20 seconds. Probably a little bit harder to kind of put into practice than it sounds, but we do recommend often looking outside a window. You know, 20 feet probably isn't far enough away. You want to try to really focus outside a window to really expand your space. And to kind of go with what you were saying with your class yesterday, the first thing you talked about was breathing. And I'm sure you've heard too, like just sitting in a screen, it changes how we breathe. A lot of times looking in front of a screen all day, we're not doing, you know, the proper belly breaths that we need to be taking, and that puts you in a sympathetic system, fight or flight mode. Same thing with our vision. If we're focusing up close all the time, you know, that is kind of related to the fight or flight as well, and that can kind of push you into that stress mode consistently.
Being in the computer screen, not just the nature of the emails and the stress of work and financial strain and political strain and all that, you're saying the actual act of sitting for that long in one position is putting you in fight or flight.
I would say like probably like a combination of the cognitive demand and what the fight or flight system does to your visual system can kind of cause your visual system to be stuck in that overstrain. And as you know, our bodies will adapt to stress. And so that's why a lot of people become nearsighted after, you know, going to college, where they have to look at something up close, spend more time straining their eyes up close with a high cognitive demand. That's where we kind of see the visual system start to shift.
Interesting, yeah. And again, with your line of work, interestingly, have you noticed a difference generationally, because the kids that we have growing up now, whether it's Generation Alpha, I guess, is that around the kids born in the 2000s, I think, and now Generation Beta just started 2025. But are you seeing a difference? And how long have you been practicing again?
Yeah, so I graduated in 2013, so almost 12 years.
Okay.
Yeah.
So even then, and when you were, I assume, in school, you're going through, and tell us one more. Optometry is through medical school?
No, we actually go through optometry school. So it's undergrad and then 4 years of optometry school, which, you know, we spend 4 years slowly dedicated to the eyes and the vision, where, you know, ophthalmology, they're more focused on surgery. So they're the medical doctors. They do their, you know, short little area of learning about the eyes, and then they go through residency.
Gotcha. So time frame wise, again, I guess my question is, are we noticing a big change in the trend again from a physical therapy perspective? Kids are getting less healthy, they're getting more sedentary. Some of these generations, the one positive seems to be a big thing is there's less alcohol intake, significantly less alcohol intake. But from a screen, living on the screens, I don't know if you're familiar with Jonathan Haidt.
Yes.
The Coddling of the American Mind is one of his more famous works. Anxious Generation is the new one. I'd love to hear your thoughts on that, and just like the change in the nature of culture, especially American culture. Again, kids being on their phones, screen time for younger kids, and then how that might be affecting vision.
Yeah, absolutely. So so much to dive into.
Yeah.
So I'm just like, where do we even start? So for sure, even like with the start of computers and introducing that into the workforce, all of a sudden we started seeing, 20 and 30-year-olds start needing glasses, whereas that wasn't a case, before the 90s, I would say. And then definitely with COVID, when kids were online schooling for a lot, we definitely saw a huge jump in nearsightedness. Now, this hasn't been an issue in China, so a lot of that research comes from, Asian culture, where studying is a big part of their childhood lifestyle. But we're definitely seeing more and more nearsightedness or myopia come into play, and myopia management is definitely a big specialty area that is becoming more popular. I will say my husband and I have been practicing some of these myopia management thoughts and before COVID. Yeah.
Gotcha.
But the other thing that, again, linking to your movement workshop yesterday, one of the things that you had us do was stand on one leg for a minute. And I don't know if you know, but I think right after COVID, maybe 2021, 2022, they actually changed the childhood norms of being able to stand on one leg. And so because kids weren't able to do this as much, they kind of took or delayed that requirement. And sorry, I'm not really clear on the data, but I think I think at like 3 years old, kids are supposed to be able to do it. And because kids weren't able to, I think they said that it wasn't, a milestone that kids should hit until 4 or 5 years old.
I'm gonna have to check in. I know I have a pediatric physical therapist on here, so she might be able to talk to that. So we'll circle back to that. I forgot what episode. I won't say in the 90s of episodes, but one of my classmates actually from PT school.
That'd be great.
Dr. Anna. So yeah, that's a good thing to check in on. And again, I think in general, we're seeing a lot of things change of military requirements, police, fire force, all these things are, in order to get the numbers that we want, they're having to change the minimum standards. So that's interesting. And then yes, again, are we diagnosing certain conditions more because we've changed the diagnostic criteria, like ADHD and things like that, or autism? We're seeing those rates certainly up and up. But yeah, that ties into a little bit of the other question there in terms of vision. Do you think that, again, just the less healthy, the more diabetic type of diabetes is on the rise, things like that, sugar control, hormonal implications, we're going down the rabbit holes of microplastics, all these kind of things. Just as an overall, when I hear functional optometry, I'm thinking, again, some correlation or connection to lifestyle, to healthy living, movement as well. So yeah, in your perspective, is there anything kind of connecting that metabolic, chronic disease rates to these issues with vision?
Yeah, so absolutely. But just to back up just a little bit, so with like the kids not meeting those developmental milestones, it's also affecting their vision development as well. And so, the first 5 years of life, kids are born with sight, but even then they don't fully develop 20/20 vision until they're about age 5. But those skills required for reading, those aren't solidified until age 6 or 7. And so when we're not requiring the kids to meet those gross movement milestones, and yet the academic demands are required earlier and earlier, kids are expected to read in kindergarten. There's that big disconnect, and we're definitely seeing more issues. And so, bringing your kids in early to a functional behavioral developmental optometrist that understands the vision development side, they may be able to, provide glasses that can just kind of help the brain and the eyes connect to help them meet those academic demands. Or, if a kid is struggling, just giving intervention options where we can train those skills. And then back to your other thing about the metabolic, definitely, the health of the eyes is really amazing. The back of the eyes, we see a lot of vasculature. It's really the only place where we can see vasculature. And so at your routine eye exam, when you either get dilated or take the retinal imaging, we can diagnose early signs of vascular conditions or even diabetes before they happen. So even if you're not noticing vision changes, we always recommend the annual eye exam just because we can watch those trends. Unfortunately, last year I had a patient, he came in, he hadn't been in for over 3 years, was seeing 20/20, but he actually had a stroke in the back of his eye.
Wow. Yeah, a couple things come up as you're talking through that. One is, yeah, I think of glaucoma as something, and maybe you can define it for the listener and viewer.
Sure.
But I've always, similar again, just overall health. Glaucoma is something that tends to happen to folks who are a little bit less metabolically healthy. And one of the solutions is to smoke weed, pretty much, or THC or what have you. But seems like that kind of releases the tension. If I'm oversimplifying the mechanics of the way the eyes work, but let me know. But I always thought it was just like, cool. The weed actually relaxes those tight muscles that are kind of restricted and allows them to again see a little bit better, a little less foggy. Is that anywhere near accurate?
So they have found that weed does lower the eye pressure a little bit. However, for you to consistently keep the eye pressure low enough to manage the glaucoma, you pretty much have to be high all the time. So
right. Well, that's where it's like, yeah, it helps me deal with this. Or I think people eventually find their dosage that maybe, if they're taking a gummy or it's like 5 milligrams or whatever. And we're in Colorado, folks. It's fine. Anyway, so that's an interesting thing. But in terms of, overall health, again, I have found the one time I did no caffeine. I should say no coffee. I did have black tea and green tea during that month, but I minimized it a lot. This was toward the end of my time in Dubai, so I want to say around 2017. But I noticed in the 30 days, I don't know if this is something else. I'm just curious. Going to throw eyeball questions at you.
Yeah.
But I found my peripheral vision actually improved. Again, I don't know if that was just to get away from that stress of constantly being on this caffeine drip.
Yeah.
And literally right before you got here, our 2-year-old was having a little bit of a tantrum. I went up, I was like, okay, what's going on, dude? And then I was like, let's do this breathing exercise. Which he just was fascinated by, watching the thing and watching me breathe. I do my Whoop version of it, and I'm happy to share that. Have you seen that? It has the visual, and you breathe with it.
Oh, no, I haven't.
And then you breathe out with it. So he was kind of super fascinated by it. But point being, as I did it, there's an increased relaxation and increased alertness. And again, when I do deep enough alert breathing, which is basically it's rapid inhale, so and actually the exhale is supposed to be more passive, and you do 20 of those, then there's a pause, and there's a little more specificity to it. But I bring all this up to say, same thing. I just did that 3-minute little drill.
Yes.
Same thing. My alertness and my peripheral vision seem to instantly improve, just from being stressed out and whatever. But please explain to me or the listeners how the breathing practice and or the caffeine situation, again, just stress overall. Maybe there's some connections again to tension headaches, things like that, of how that peripheral vision is a sign of health.
Yeah, absolutely. So I might be not hitting what you're saying right on the mark.
That's okay. My question was, I'll blame my question.
No worries. But this is a little bit, I would say what's unique with functional developmental behavioral optometry is we do consider that sympathetic stress response a lot. So as you know, our body's response to stress, whether it's a lion chasing us or just that chronic work stress, mental load, inability to manage emotions and all of that. So when we are in a stress state, how we process peripheral information and central information is very different. When we are waiting for a predator to come, we are more sensitive, more alert to movement and what's happening around. And our central field, our functional, what we call our functional field, really shrinks down. So at any given time, if we're focused on something, we should be able to take in and process 15 to 20 degrees outside of center and process that information. When we are very stressed, that functional vision's really condenses down. And so the amount of information we can process from center is probably between 1 to 5 degrees. And so for us to be able to assess our environment, we have to make more eye movements and piece those parts of the information together. As you can imagine, that's not very efficient. There's more room for error. That's like when you're driving, you're stressed, and then all of a sudden you go and you're like, oh crap, I didn't even see that person stepping out in front of me. Whereas if you're more relaxed, your peripheral field is more open and you're able to process more. So that's part of it. And definitely too, maybe the next time you kind of practice your breathing, you'll notice that how you view space is going to be different as well. So not only is your peripheral bigger, but you'll feel like the room is bigger than where you're starting out.
I could say I was lightheaded, but I feel like that lightheadedness in that moment is in line with that like change in visual perspective. So it's super fascinating. That's very cool stuff to pay attention to. One other question I have for you in that regard is, in terms of all this time, and I think again the big takeaway for me, and hopefully the listener, I'd love to hear you guys leave in the comments, wherever you're at. But I think a lot of folks are just living in this chronic stress state, whether it's constantly work, and always being on our phones, even doom scrolling, as the term goes. That's a modern term, but then on top of that, the how this presents. Whether it's and that's my next question, I guess, in terms of TMJ stuff, visuals right next to that, tension headaches, all these kind of connections. I get a lot of folks with TMJ disorders, or TMD, as the technical term would be. But are you referring with any practitioners for whether it's dentists, DMDs, physical therapists who specialize in TMJ, or is that something you're kind of able to help with some of these exercises?
Right. So definitely if a patient comes in, so this is also why I feel like is really helpful if patients come in routinely to see a functional doctor, optometrist, even if they're not necessarily noticing vision changes, but because each time I check your vision and your glasses prescription, I notice certain subtleties that can really help. So a lot of times, sometimes I'll pick up astigmatism, which is often a scary word, but it just basically means that you have two different focal points. But where the astigmatism locates tells me how your vision is functioning. So at a certain location, it tells me whether you're able to release focus after focusing up close. At the opposite perpendicular angle, it'll tell me if you're having trouble bringing focus into up close. But at the oblique angles, that usually tells me if you have some type of postural issues, neck or back strain. And so when I see those subtle changes, rather than prescribing the glasses, because I'll just lock that into your system, I talk to patients about, maybe getting a massage, seeking out PT help if they have some chronic injury or back or neck tightness, talk to them about their workstation setup, that type of thing. Probably need to connect a little bit more to the dentist. I haven't gotten quite there yet, but
I haven't seen a lot of dentists that, well, I guess I don't want to say that, but so far, I do dry needling through that TMJ space and masseters and temporalis muscles, all that. I just had a dentist in here. I'm not gonna say his name, but literally he was the last person on this table. But the idea that what I see them doing is more night guards, which sometimes it certainly protects the teeth, but sometimes I think creates more tension. And I was talking about this with my dentist friend here, of the fact that they can set the mouth guard different ways, which I don't think happens enough when I hear people being on mouth guards. I actually had a patient as well who's supposed to see me this week, and we had been working for a little while, did some needling through there the last few weeks, and then this week she said, you know what, I finally decided to take out my mouth guard, and I don't need to see you this week because it seems like all the symptoms are pretty much gone. In line with, I think, that the needling, just a lot of that tension releases. So even when you were saying that, if folks are watching, as you said, tight necks and things, I had to crack my neck because there's like that placebo effect. But you mentioned astigmatism. I will admit that I have astigmatism, and I cheated my way through many an eye exam in elementary school when they were doing that. I didn't want to be like failed the test,
right.
And I kind of did like, let me. I won't actually tell which eye it was, but basically, in case anyone sees me in public and wants to stab me in the eye, you'll have to guess which eye it is that I can see better with. But to my knowledge, the last time I had a vision exam, my weak eye, which has astigmatism, I'm pretty confident that was the diagnosis I got, which I believe was congenital. I believe I was born with it, and so I believe they said it was like 2400 was the vision. So like legally blind, I believe. Is that technically legally blind?
So it depends. If it's been that long, your brain may not have fully connected with that eye. So even if we did correct you, you may not get
and that was when the last time, and this was probably 2009 when I actually had like all my insurances. That was my first jobs, and I had like, and literally there was someone in the building, and like they did the full eye exam, and they were like, Does this correct it? Does this correct it? Does this correct it? I'm guessing they went through all the different levels of corrective lenses and nothing made any difference. And like, yes, with my weaker eye right now, again, I don't want to give away which one it is, but like I wouldn't be able to, like, maybe I can see shapes, but like I could, you know, if you were holding up however many fingers, I might be able to see that, but from a certain distance, that's going to be gone. So anyway,
so that's the beauty of neuroplasticity.
And I would say my good eye
Yes.
has overworked or is strong enough where like I feel like
Just
I have
compensates for it.
I and again I don't think I had it tested. Maybe it's in my own mind, but I feel like it's like 2010 vision, which is better than 2020, right?
Yes.
So just for yeah, I think so. Anyway, so I'm pretty sure that's accurate. But yeah, so just overcompensation and again playing sports and things like that. I actually always felt like I was extra, like I was a quarterback. I was you know, had extra good vision on the field. That was one of my strengths, even if I didn't have the best physical demands or whatever or skills. But yeah, so astigmatism. I'm 41. I don't think there's anything that's going to help now. Corrective lenses, again, probably not.
So yes and no, because of neuroplasticity, we can train that eye to improve. But right now, you're functioning as a one-eyed person, even though you have two eyes. And so your stereo, your depth perception could probably improve, which would probably make you a better athlete.
I'm a pretty good athlete. I'm pretty good with it now.
But yeah, make you a better athlete, and so we can actually like train those skills. Yeah.
Okay.
I have colleagues that have patients that was like I think the oldest patient was like 100.
Wow.
And 5 that went and did vision therapy to improve how their eyes work together and things like that. So but back to there was like so many levels I want to talk about, but I think back to the part about like the TMJ part of things is. I think what makes me most different is rather than seeing like nearsightedness or an eye turn or a lazy eye as the or as a diagnosis, I try to approach it as what if that's the symptom and where is the underlying cause. So I think even with our body sometimes where we have neck or back pain is usually a compensation of some other weakness. So same thing, I try to look for, you know, lifestyle changes or certain events, trauma that may have caused a shift in how your vision works.
Yeah, orthopedically injury-wise, to your point, we always say like, if your shoulder's hurting, that's the victim. The criminal is somewhere else.
Exactly.
Usually, and famous Ida Rolf, who's a famous Rolfing, if anyone's heard of that. Her famous saying was, "Where you think it is, it ain't." Basically, to your point there. But yeah, so you're thinking there's other causes going on.
Absolutely. So most of the time, if you know, patients are coming in for the first time, I can't see distance as well anymore. I'm usually giving them computer glasses because that's typically where that strain and the issue is.
Okay. So, and if I can ask a personal question, I noticed you have glasses on. Yes. I assume they're corrective.
Yes.
Is that something you had as a child and then that got you interested in the field? And then, because like with physical therapy, it's always people in their physical therapy application, oh, I had this surgery and I went through physical therapy and my physical therapist was great and now I want to do this. Or my grandmother broke her hip and then I saw the physical therapy and it looked amazing. So same kind of thing where you had the problem and you wanted to kind of solve it?
Yes and no. So I was an avid reader and so I became nearsighted at a very young age. And I went and saw a pediatric ophthalmologist and he felt that giving me stronger glasses would allow me to grow into these lenses, but instead he actually perpetuated the problem. And so yes, that is part of the reason why I am so passionate about myopia management or nearsightedness and trying to help prevent or slow the progression of it in kids. But I really wanted to work with kids. I love kids. Interestingly enough, whenever I did those aptitude tests in college, I scored highest on rehab. And we'll kind of talk about that after. But so then when I was, you know, I looked into like chiropractic school, I wanted to be a pediatrician. But then I was recommended to look into the vision therapy aspect of optometry. And that's kind of where the functional side of it is. But by teaching kids how to use their vision better, 1 in 4 kids actually have a vision-related learning problem. And when you look at the symptoms of vision-related learning problems, 16 of those match ADHD symptoms. So it's estimated that 1 in 4 kids that are diagnosed with ADHD actually just have a vision problem. And the kids actually have ADHD if they also have a vision related learning issue. Their symptoms are much exacerbated.
Yeah, I think there's also like prevailing thoughts or philosophy that a lot of ADHD is also very just poor sugar processing.
Yes, absolutely.
On top of, yeah, again, maybe too much screen time or the wrong approach around screen time.
Yeah.
Seems like that. And yeah, we have a toddler. You have a few kids.
Yes.
I guess tell us as a parent, and with this knowledge that you have, maybe things that other parents can take away when it comes to visual evolution or health or for the kids. And what, if you don't mind sharing the ages of your kids?
Yeah, so I have four. The oldest is 8, and then I have a 7-year-old, 4.5-year-old, and a 2-year-old. And so definitely like screen time management is important because our brains are developing so much. What happens on a screen is that there's so much stimulation, and again, Jonathan he talks about this in the anxious generation, in that when there is so much stimulation, anytime we take that away, the kids are seeking more and more stimulation. They just can't manage that, and so for younger kids up to age 3 and 4, you probably want to do like 5-minute increments. And like it's great because Disney shows they have those mini episodes where they're only 3 to 5 minutes. So after every one of those, you should get your kids up. I tell them, do 10 jumping jacks, run around before you sit down and watch another show. And then as they get a little older, you can increase those increments before they need to get up and move around a little bit.
To your knowledge, is there one organization, is the American Academy of Optometry or anything like that folks can go to for any of this information? Not quite.
Right. There's a few. The one I'm thinking of right now is there's a College of Vision Development, but they just changed their name and I can't quite remember what acronym is.
We'll possibly leave it in the show notes, or if anyone knows it watching, leave it in the comments.
And then there's a Optometric Extension Foundation that has this more behavioral functional standpoint too.
Okay.
From there you can find providers that kind of practice this more functional type of optometry.
Very cool.
But back to the rehab side of things, we do work a lot with traumatic brain injury patients, so post-concussion. Once I tell people, your neurons is like a big ball of wires, you throw it against a wall, they're going to get all tangled and your processing is less efficient. And so a lot of patients, especially if after 1 month after injury, you're still having a lot of dizziness, nausea, disorientation, especially in busy environments, and optometrists can definitely help with that.
Do you see a good amount of concussions?
Yeah, so actually I worked in an office before that did work a lot with a lot of brain injury. Right now I'm in private practice, but with my new office, as you know, a lot of times with severe traumatic brain injury patients, they just have trouble functioning, and then they have so many therapies to go to, and so it quickly becomes cost prohibitive. So one of my goals is to have these classes where those that are really struggling, I can just get them to a point where they can get to cognitive and vision therapy to really improve. Because at first they're so symptomatic that they can't even last 15 minutes in therapy.
That's the severe TBIs. What about just like a normal concussion? Again, I had a 14-year-old soccer player.
Yeah.
Had a concussion from. I didn't see him for the concussion. I don't do concussions. I've had 3 of my own. But those kind of like more, again, hit his head against the way header or whatever, or collision. A little bit more traditional concussion symptoms, a little bit of unconsciousness, and then get 15 seconds back out on the field. We can do the testing. There's a lot more attention to that nowadays than when I was playing sports in high school and college. But yeah, in that situation, I think there's a little bit of changing perception. Again, I don't know, it doesn't sound like you're like the expert on concussions, but I figure I want to ask this question of, there's like the put that person in a dark room so they're minimally stimulated, allow that brain to heal. A big thing there is as well, that sometimes gets ignored, and I'm going to go ahead and say this as disclaimer, not medical advice, all that, but high dose fish oil, EPA, DHA, really can help the healing of the brain, and that's something we should be doing, I think, every single day. All of us. I do 5 grams.
Quality fish oil.
High quality, yes. But I do like 5 grams of EPA, DHA a day myself. trying to keep my brain healthy, and creatine, all these kind of things that might help with that. But so yeah, I don't know if you feel comfortable answering that. And I think it's changed a little bit of like less. Don't go and get overstimulated. You don't have to be as much. It's a little bit kind of like we used to say, if you sprain your ankle, don't rest it, don't really move it. Versus now the thinking is more actually no, get it moving, but like in a controlled way, because that blood flow is actually good for the natural healing process. Same thing here is like maybe start using your mind, and if you do so much thinking like, oh, if you do a crossword puzzle and you start thinking, you're like, that hurts my head. That might be too much. But again, I'm not the expert on this. I don't know if you feel comfortable.
No, absolutely. So a lot of times these patients, they get back into that overwhelm really quickly. So it's a very delicate balance of not falling. I tell people like falling off a cliff. So if you push yourself too hard, you'll get to that point where, you do have to go into that dark room. And for some people that can be, a day or two before they can start functioning again. You definitely don't want to get to that point, and you want to find that delicate balance where you pull back as you start to feel yourself falling into that sense of overwhelm. But definitely like stay off the screens at first, but maybe do little bits of like light reading. You don't want to be just fully in a dark room, but you don't want to like not do anything either. Nutrition definitely is important. And then, with optometry, we can get you tints or glasses to just kind of help the brain heal, and also to help reduce some of those visual symptoms and triggers.
Very cool. I don't know if there is a standard for this. And again, if a 14-year-old, as an example, does have that concussion, I think they're generally going to talk to the coach. Maybe if the team has a medical person there, that's going to be who directs that kind of concept. Maybe they go to their general practitioner. Do you think is functional optometry something folks should be looking out for in those situations when their kid is out of it?
I think there is an article that said that a functional optometrist or vision therapy should be one of those top things. And this is where that rehab is coming. I've really enjoyed working with patients that have struggled with these symptoms for years, even after a concussion. But again, if you're having trouble like reading again, or just cognitive functioning, going to stores, busy environments really causes you to feel disoriented, definitely go see an optometrist. And as you know, concussions are cumulative, and it doesn't take much after one to start feeling those symptoms again.
Yeah, and one of the worst things is that kind of, is it the second concussion syndrome, where if you have a second one within before it's healed. That's why like in the NFL, if anyone follows that, they're very careful before they let a person clear protocols, and there's been a lot more attention to that. So all good stuff. Cool. Wrapping up a little bit, just to be respectful of your time, folks. And I have another podcast recording starting soon. I can't see the time. That's not good. Am I supposed to be able to see the time there?
I don't think I can see it.
That's pretty far. I mean, my vision's pretty
small.
good. Yeah. Wrapping up a little bit, tell us a little bit about your practice. You are